Copyright, University of South Australia. This recording may contain third-party copyright material. Apart from any use permitted under the Copyright Act 1968, no part of this recording may be reproduced or rebroadcast by any means or process without the prior written permission of the University of South Australia and the copyright owners.
Hello and welcome to a secondary video on the male reproductive system. So what we're going to have a look at in this video is a bit more of a detailed pathway of how sperm moves from the testes through to a final emission stage. So if we have a go at drawing some of the structures which are responsible for production of sperm and therefore the transportation of sperm to begin with. So if we start with the testes, so originally the testes would begin its life inside the abdomen as the gonad and then descend through the abdominal wall and down into the scrotum. So the testes has some structures on the inside, and these are called seminiferous tubules, and this is where the sperm would be produced and start making its way towards the upper aspect of the testes. From there is a pipe which extends out of the testes and then from there towards the epididymis. So this structure here is called the rete testes, and this is the tube which is taking the sperm out of the testes. Now the epididymis is actually just a highly coiled tube which makes almost like a solid structure. So if you think about it, just think of it like a maze, like a highly coiled labyrinth of a tube. Now, it has a few different parts. It has its head and its body and then its tail. Now, if you're looking at the testes from the front, the head of the epididymis sits on the superior aspect. The body and the tail then go to the posterior and lateral aspect. So with the thumb on the posterior aspect of the testes, you can feel the epididymis tracking downwards. From there, the Vas Deferens is then a long tube which passes up from the tail of the epididymis, and this would be carrying sperm towards the prostate gland as an example. So if we label some of these things, so we've obviously got the testes here, then these tubules in here are rete testes, then the epididymis, and then the Vas Deferens or the Ductus deferens, your choice. So if we talk about the Ductus deferens or the Vas deferens in a little bit more detail, we would then talk about it as it is linked in with a whole bunch of other structures within the spermatic cord. So the spermatic cord is a structure which passes down through the abdominal wall and would then suspend the testes inside the scrotum. So having a look at this model here, what we can see is that if we split it in half, so we get a bit of a better look, on the inside of the abdominal wall here, there's an opening, which is the deep inguinal ring. So you can see a few things passing through here already. So we've got the Vas deferens or the Ductus deferens, and then we have testicular artery and testicular vein passing through this space. So the deep inguinal ring you would find lateral to your inferior epigastric vessels, which are a branch of the external iliac. So where the external iliac would be passing under here like this, a branch then passes up onto the posterior aspect of rectus abdominis, called your inferior epigastric vessels. So from there, the spermatic cord passes through the inguinal canal. So the inguinal canal is a space then you would find existing between the deep inguinal ring and the superficial inguinal ring here. Now what you can see is that it's going to obviously pass through these layers of muscles. So this most internal layer is the Transversus Abdominus, then the internal oblique and the external oblique. Now these muscles attach to the inguinal ligament in different ways, and therefore different layers of these muscles would be picked up by the spermatic cord as the testy passes through and descends to the through the anterior abdominal wall. So transversus abdominis, you can see, attaches to the inguinal ligament here beyond the deep inguinal ring. So its muscle fibers aren't actually pulled through with the spermatic cord. But what would be laying on the inside here, which is pulled through, would be the transversalis fascia and the parietal peritoneum. So these structures here, or those structures, they make layers like the tunica vaginalis of the testy as it passes right down into this space here. Internal oblique, you can see that its muscle fibers actually extend beyond the beginning of the deep inguinal ring and the inguinal canal. So what actually happens is as the testy passes through, it pulls that layer of muscle with it. And that layer of muscle actually forms this outer layer of muscle here around the spermatic cord, and that's called the cremaster muscle. So inside then the spermatic cord, we can see the vas deferens and the ductus deferens like we said. Then we can see this complex set of veins here, which is called the pampiniform plexus, and then you would have the testicular artery within there as well. You would also find that there is two nerves. One nerve that passes through the deep inguinal ring to then come and innervate the cremaster muscle, and that's going to be the genital branch of your genitofemoral nerve. And then a nerve which is coming around the upper aspect of the iliac crest and then joining in with the spermatic cord and passing through the superficial inguinal ring would be your ilioinguinal nerve. All right, so this set of veins here has a really important function. So that is, as the hot incoming blood is coming towards the testy, these veins are acting kind of like a radiator. So they wrap around the artery, and as the hot incoming blood comes in, they then take that heat away so that the testy doesn't become too hot. So there's another function of how the testy would regulate its temperature. The cremaster muscle, though, as we said, is a muscle which is innervated by the genital branch of the genitofemoral nerve, and in this side of the model you can see it slightly better, all right, running the whole way down to the testy. Now what it does is it would contract when the temperature of the testy is too low to bring it closer to the body, and relax when the temperature is too high and take it away from the body, because the testicles like to range about 2 to 3 degrees lesser than body temperature. So then once again we can see the testy here, and then the head of the epididymis up here, all right, sitting on top, and then its body and its tail would be passing behind, as we said. Now there's another muscle inside the scrotum, and that's the layer that you can see here, the next outer layer, and this is actually called the dartos. Now the dartos muscle is the one which would give the wrinkled appearance when the scrotum is to be pulled closer to the body to decrease its surface area and help to maintain temperature. So if we talk about how sperm then goes from there, all right, so from the testee to the epididymis for maturation, and then up along the vas deferens as it travels, we need to then talk about the prostate gland and the seminal vesicles and how that then comes together. So here we can see the testee. Sperm would be passing up through the superficial inguinal ring, the inguinal canal, and the deep inguinal ring. It then loops back like this to lie, as you can see, anterior to your external iliac vessels. It then passes down and around the posterior aspect of the urinary bladder. So if we take this out and turn it around, what we can see here on the posterior aspect of the urinary bladder is this structure is the ureter coming in, and this structure is the vas deferens coming behind. This here, this small kind of grainy structure, this is the seminal vesicle. Now, the seminal vesicle and the vas deferens will meet together and form a tube called the ejaculatory duct, which then comes into the prostate gland here before it meets with the urethra. So if we were to draw that, let's have a go at drawing it from the posterior aspect. So here, let's say we've got the urinary bladder. So here's its base, its lateral walls, its neck, and then you would have the prostate gland sitting around here like this with the ejaculatory ducts coming in. So urethra, here the prostatic part of the urethra meeting with the ejaculatory ducts like this, and then passing out the bottom of the prostate gland. All right, so if we continue that drawing, let's just finish that up. So urinary bladder, prostate, ejaculatory ducts, okay, then that's going to be the vas deferens passing off in this direction, and then attached here would be the seminal vesicle. Now obviously that sits on the posterior aspect of the bladder that we can actually see there, but just for the purpose of the drawing, let's just draw it slightly separate so we can visualize it slightly better. Okay, so seminal vesicles on either side, and the vas deferens passing up like this. Now, as you can see, from there on, the urethra is going to be a shared tube. All right, obviously not at the same time, but once sperm passes into the prostate gland and into this part of the prostatic urethra here, it would be a shared tube. So we need some other structures to help lubricate this tube and also clean it, which we'll talk about shortly. So let's have a go at labeling this one. So we've got the urinary bladder, the vas deferens, seminal vesicle. All right, so what does the seminal vesicle do? It produces about 75-ish% of the total fluid bulk of the emission. So it gives them a medium to swim in, and it also gives them some glucose, so some energy. The prostate gland here would produce about 15 to 20%, all right, ish, of the fluid bulk of the emission, and then sperm make up only about 5%, which about in total is about 5 millilitres. Sometimes 3 to 5 is described in different books. So from there, this part, this is called the ejaculatory duct, which is then entering and merging with the prostatic urethra. Now, as the urethra passes out the bottom of the prostate gland, it passes through the pelvic floor muscles. Okay, so this part of the urethra that would be here within the pelvic floor muscles is called the membranous part. And there would be a gland sitting either side in the membranous part of the urethra there, which is actually helping to lubricate the tube. So a clear lubricating fluid is produced by some bulbourethral glands. To help lubricate and clean the tube. Now the prostate gland, it will also, like as we said, produce some fluid, and this is going to be there to try and help neutralize any acids, as well as neutralizing any white blood cells that the sperm will come in contact with. So then once obviously the urethra passes through the membranous part of the pelvic floor, so the muscular part, it then passes into the spongy part of the penis, so corpus spongiosum, so you would call this the spongy urethra. All right, so I hope this has helped with a little bit of the detail of the passageway of sperm. All right, and we'll see you on the next video.